Hello, this is Dr. Kavian Milani for Virginia Medical Updates. Today I'd like to talk about two issues that have come up in medical literature in the past few months that I think is very beneficial for everyone to know. The first one is that after a number of important studies that have been done over the past couple of years, there has been always a particular concern about dementia and about whether in the population that are becoming losing memory or people that are moving towards Alzheimer's, if there is any potential benefit in treatment that can prevent that. But there are a number of studies that show that a number of medications have been effective and are working to some extent. They basically bend the rate of the rise or the progress of Alzheimer's and other forms of dementia, and they're pretty beneficial and useful. But one recent study that came out was very important. There has been this idea in the medical community that basically, for whatever reason, that the use of statins, the cholesterol-reducing medications, due to some unusual effect, maybe anti-inflammatory effect, maybe anti-plaque effect, or other factors, it could actually cause a decrease in the Alzheimer's rates. Well, it turns out that this is a complete false assumption, that the use of statins in this population did not really lead to any improvement in terms of prevention of Alzheimer's disease or any form of dementia. So as always, increased activity, basically dietary lifestyle issues, sleep adjustment, treatment of depression, and again, management of cholesterol on a normal level is very helpful. Exercise, physical activity, grip strength. But what has not been beneficial is the use of statins on a random basis for all populations, and regardless of statin and regardless of state of the patient, to cause a decline in dementia or Alzheimer's incidence in the patients. So again, as a whole, we do not at this point, based on evidence and good studies, cannot recommend the use of statins to prevent Alzheimer's disease, and this is basically all there is to it. The other issue that's very interesting is the prevention of falls in the elderly. The elderly obviously have a high risk of falls. Falls in the 65 plus population is extremely worrisome and dangerous. People that fall down, there's loss of productivity, and about people that fall down with a hip fracture, 25% may actually be dead in 1 year's time, and there is a huge mortality, obviously, and a huge morbidity with these falls. The most important issue is that if there is a vitamin D deficiency, the treatment of vitamin D deficiency is beneficial. But random vitamin D supplementation does not cause a prevention in falls. Again, I want to repeat this again. The random supplementation of all comers with vitamin D does not lead to a decline in falls in patients that are 65 years of age or older. However, in that population that has a low vitamin D, the supplementation of vitamin D actually does help. Mega dose of vitamin D, pills of 100,000 units or more, or 1 million units, have not been shown beneficial and potentially actually can be harmful. Then the normal kind of random advice about fall prevention and about careful household adjustments are not really beneficial, even though it's done frequently. What is really beneficial is an analysis of the house, of the home, by an expert person that could look for risks of fall. Where are the cables? Is it carpeting? Are there stairs? How is the lighting issue to help prevent any type of fall? Again, these falls at a minimum on average cause about a number of months out of work, basically, and they have a significant amount of mortality and morbidity and loss of function, and there could be really bad things for the patient. So every fall, on average, costs the patient also about $17,000 every hospital admission for a fall. So these falls are not benign events, and so they need to be prevented, but the best thing to do is to bring the vitamin D level up when it's needed. Do a careful analysis of the house in terms of lighting, wiring, carpeting, stairs, to make sure that the bathrooms are accessible to the patient, that the patient has some help when getting in and out of the bathroom, and when they have to go to the kitchen, etc. And basically, we need to make sure that the elderly or 65 and above are actually safe doing this. One simple test is a get up and go test, which is a very useful test to predict falls, which basically you have a patient kind of set up from a seated position and go a number of steps and come back down and sit down in a matter of 3 seconds. And if that can happen, then that really means that the patient is safe for this particular fall. But most, oftentimes elderly are not able to do this, and that means that they're increased risk of falls, and these falls have to be taken very seriously. Again, also strength training, getting them stronger, grip strength, walking, and in the cases where we have to, supplement their vitamin D is exceedingly beneficial. This is Dr. Kavian Milani for Virginia Medical Updates. Thank you.